Hello, good morning, students. Today we are going to discuss the topic on agentic AI in healthcare industry from the course Generative AI and Agentic Systems. As you know that we are living in the autonomous era, most of the autonomous AI agents are used for the public welfare and for the people support. So here we discuss one of the intelligent patient caring systems from the healthcare industry. And this case study will help you to understand how the generative AI and agentic AI it is benefiting the healthcare industry. So before that, let us take a quick poll on this question. Would you trust artificial intelligence for the patient monitoring? So if you really have a reliability with the AI systems, you can definitely answer. But you know that there is a surprise. The survey which was taken among the people who are facing the physical health and mental health issues, when they have a meetup and follow up with the doctors, 58% of people are having the physical health follow-ups and 42% of people are having mental health follow-ups. The remaining 42% and 58% vice versa, they are not following up with the doctors. So here is the situation, how the reliability with the and follow up with the AI systems. So to differentiate the Gen AI and agentic AI, the main differences are the creates content and how the contents can be leveraged. So which is reactive and which is goal driven and which one is single step and which one is multi-step. So need to have an understanding on that. And here the subject session objectives are to understand the agentic AI clearly and to explore the healthcare industry case study. Then we apply the design thinking and also to analyze the agent workflows. Finally, we will evaluate the benefits and risks. So when we have the use cases of healthcare industry in agentic AI, you know that initial step we can have claim processing, then we can have care coordination, then we can have the data reconciliation with the healthcare management data, then we'll provide the personalized patient care, all these things, right? And here you see healthcare problem statement, how it is explained. There is a question like, can AI agents coordinate the patient care? It is very difficult when it is in manual situation. There would be a long waiting times, manual scheduling, and physical physician may get burned out, and because they are handling the fragmented records. But when it comes to AI, it will be the next door to you. You can get support very quickly and very uh, promptly. And let us take the persona of a 58-year-old diabetes patient having the pain points of recalling the medication reminders and long waiting and the difficulty in understanding the report. In such cases, the agentic AI can help the patients by going through all the parameters which is given in the diagram, like their neuropathy and their BMI, their renal dysfunction, genetics information, lifestyle, and their age, metabolic syndrome. All these factors behind to calculate and inform to the patients about the health. And when we keep our empathization more, we need to have an understanding about the various stakeholders who are involved in the healthcare management ecosystem, like patient, doctors, nurse, admin, and pharmacy. And they are providing the faster care, personalized support with the reduced workload by using this AI agentic systems. So when how we define the core problem now, here the core problem is to healthcare providers struggle to deliver the timely personalized care because of the fragmented systems and administrative burdens. So how this fragmented systems are happening because confusion and inefficiency and redundant testing and conflicting prescriptions because they find difficulties with handling all these things, right? So that this kind of consequences only we need to understand. Because of this issues only we are coming up with a solution through agentic AI. So when I did the problem with the different agents, it provides a much better results. Like clinical support system, we have a separate agent, and for monitoring the patient, we have a separate agent, and for the administration, we have a separate agent. So when you look at that, the ecosystem of AI healthcare agent, we can see that how the conversation is happening through the agents and how the clinical decision support system is happening, is functioning, and predictive systems and compliance monitoring system, and where the multimodal agent systems are required for collecting the MRI scan report, CT scan report, and for the lab reports, right? And finally, how the documentation of a patient data is being recorded and how their claim is being validated when they are going for insurance and all these things, including the fraud deductions. And finally, the prototype here, it is like patient initial, then followed by the agentic assistance. Then it will connect directed to the clinical agent, finally the doctors and the treatment and monitoring agents. So in between, we can use any kind of prompting between the agent system. So here the applications are very much in future. The possible uses of AI in healthcare industry, like it can be useful for predicting the diseases. It may provide the personalized treatment in future, and it will be highly efficient to interpret X-rays and MRI reports. Also, it may educate patients about the reports and the other scientific details, medical details, and it also helps patients to take medicines on time by keeping the reminder with the automated systems, right? And let's have the you group activity, and you have to take the role play of a patient, a agent, doctor, or administrator. You need to create an agentic actions and escalation points. So you are provided with multiple parameters, like you can opt out anything or you can choose opt anything, like wearable devices. One is precision medicine, remote monitoring, and robotic surgery and collaborative teams. So your evaluation will be and testing will be done based on the metrics. Your accuracy is expected 95% above, and the response time should be lesser than 5 seconds. Not because 5 seconds itself it's a big response time, and satisfaction level it is expected 90%. And here see how the agentic AI works. It has a perception context awareness, then the decision making and under various uncertainty, then the action and execution layer, and finally the continuous learning support. So here the summary where you can see the statistics from the 2020, how it is going to be in 2030. So how much $1 million the agentic AI in the healthcare market, in it is given explained. And also AI in healthcare industry dynamics also you can see that the degree of innovation, how the level of activities happening, and what is the impact of regulations and the geographical expansion of this. So it is given in the market growth. Or market concentration and market characteristics perspective. So thank you very much. We continue by the next clips.